election, both candidates and voters. We are reminded that democracy is an experiment that only works when we all participate. So everyone did that yesterday, so congratulations to everyone that did that. Let's start with the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please, Sam.
Commissioner Fleece.
Keep busy talking.
Commissioner Fleece is here.
Friend.
Here.
Hooper.
Here.
Inman.
Here.
Max Bauer.
Here.
Richardson.
Here.
Stepka.
Excused.
Tired.
Thomas.
Here.
Chairman Wheelock.
Yes, ma'am. The first item of business is the approval of the minutes of October 6th.
So move.
Motion by Thomas, support by Fleece. Any further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carries. This brings us to the first opportunity for public comment. Is there anyone in the audience wishing to make comment this morning? There's another opportunity later in the agenda. So seeing none, we'll move forward with the approval of the agenda. Are there any additions to the agenda this morning, Dennis?
Yep, motion to approve the agenda with the addition of the employee benefits agent request for proposal.
Support.
Okay. Any further discussion?
Mr. Chairman, we'll need a closed session at the end of the meeting to discuss labor negotiations.
There's a second in there. Everybody seconded.
Yep, I would add that to my motion.
All right, Fleece or
Brendan, please.
Brendan, please. Thank you. Okay, we have a motion to approve the agenda with the two additional items. All those in favor say aye.
Aye.
Opposed, the same. Motion carries. No special orders of business. That brings us to the consent calendar. If you would read the consent calendar, please, Sam.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission staff or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval is approved by single committee action adopting the consent calendar. Receive and file. Community Corrections Monthly Report, September. Community Corrections Prison Commitment Rate. Community Corrections TASS, THIS, and PRS Utilization Reports. Commission on Aging Report. Commission on Aging Committee Minutes, Governance Finance Program. Or approval. Grand Traverse Sheriff's Office items to be declared surplus, and renewal of the Traverse Health Clinic and Coalition Services Agreement.
You've heard the consent calendar. Is there anyone in the audience wishing to remove any of the items? Any member of the board?
Mr. Chairman, I'll make a motion to approve the consent calendar as presented.
Support.
Motion by Inman, supported by Richardson. Further discussion? All those in favor say aye.
Roll call.
Oh, roll call, I'm sorry.
Okay. Commissioner Friend.
Yes.
Hooper.
Yes.
Inman.
Yes.
Max Bauer.
Yes.
Richardson.
Yes.
Thomas.
Yep.
Oops. Please.
Yes.
Chairman Wheelock.
Yes, ma'am. That brings us to the department action items. First, we have the sheriff's office. He must have a little flying saucer in the parking lot at the jail this morning. I see we have an alien report.
Alien report.
What's what it says, alien assistance, you know?
Yes. They've landed.
We need a ladder to get them down out or something.
They're
I'm
criminal
not sure.
aliens.
Well, criminal aliens.
Good morning. I'm Captain Bob Hall. I'm the jail administrator, Grand Traverse County. I have two issues before this committee this morning. The first is the SCAP Award, the State Criminal Alien Assistance Program Award. This award, they say it's an award. It's a form of a reimbursement to help defray some of the costs of lodging undocumented aliens in our jail that have committed either a felony or two misdemeanors and spent at least 4 days over the period of a year. We don't have that many. Usually what happens when they come into the county jail, within a day or so, they are turned over to ICE and deported. So it's rare that we actually prosecute some of these people, but if we do and they do meet the criteria, we fill out the forms, send it in to the feds, and they dip into this little pot of money and reimburse us. The reimbursement amount for the 1 year ending June 30th of 2009 is $1,010. We would like the board's approval to accept that $1,010. The only thing that the SCAP program requires is that it be used for one of the purposes on page 3 of your handout. It's all referencing corrections and running jails. We would like to move that $1,010 to help defray some of the cost of the new software program for the jail management system.
Mr. Chair, motion to approve acceptance of the 2010 State Criminal Alien Assistance Program in the amount of $1,010 for the purpose of replacing and upgrading the current jail management system.
Support.
Motion by Friend, supported by Fleece. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carries.
Thank you. At this time, I'd like to call up Elaine Kaiser from Health Professionals Limited. Elaine is the contract manager for the medical program that we currently have in the jail. As you are aware, back last March, we moved from essentially an in-house medical program for the inmates to a managed healthcare, correctional healthcare program. I've been asked to provide where we're at with this program, and that's what this document that I handed out to you covers. What I did is I didn't have direct costs because a lot of what Health Professionals is paying I don't see anymore. That's all done through their company, which was one of the benefits. Wasn't inundated with bills every day. So what I did is I took our costs, our in-house costs for 7 months, the last 7 months of the program, compared it to the first 7 months of HP's program. So we're somewhat looking at apples to apples. I did cost comparisons. The handout that I gave you shows where we're at with the costs on the program. The per diem, if you recall, there was a cap if we exceeded the 142 inmates at any given day, and this was rolled into the presentation that I made back in February. We've had, for the first time in the last quarter, we actually exceeded an average daily population of 142 inmates, and that reflected or resulted in exceeding the cap in a $236.76 additional cost, which was factored into the presentation that we gave. I think the worst case scenario we came up with was a maximum, if I recall, of about $6,000 for the whole year if we were at 194 inmates for 12 months, which we wouldn't be. So we anticipated that would happen occasionally. And operationally, I looked at all the different benchmarks that we were looking at when we moved and made the recommendation to move to a managed healthcare program. And a lot of it dealt with liability reduction for the county, true medical people dealing with all the medical issues, and a lot less of corrections officers dealing with the medical issues. The professionalism of the clinic, the professionalism of the delivery of health services to the inmates, and we've met and exceeded all those expectations. We're very pleased with those. So we still have some bugs, and these are being worked out. We still have some increased conflict with dealing with the local mental health. The way it worked before, and I found out after the fact, that the local mental health unit would come in, assess the inmates. If they had any recommendations for any type of medications for the inmates, they would just take it to our contracted doctor at the time, and the doctor generally just said, okay, he'd order the medications, and they would do that. We had no control or real knowledge of what medications were being ordered on behalf of the inmates under the old system. The new system that Elaine will talk about here in just a few minutes tracks those very closely. In the profession, in the mental health profession, cost, everything else. I mean, they're right on it. So that has created some concern with the local mental health group who wants to still do things as they used to do, and they now have some cost controls, some protocols that they're not used to, and there's some conflict with that, but we're still trying to resolve those. Communication issues, but anytime we change a major program from Program A to Program B, there's some areas that some of the staff on both sides we're not used to. We do things differently, but that's been addressed with continued in-service training and just dealing with the issues as they occurred. Statistics, we're getting statistics now that we never received before. That's on page 4. You can see what they're doing, and they're doing a lot of work. If you recall, we had a problem with the jail inspection the last time we were inspected. The only area that we were non-compliant with the state rules was the physicals that were being done, have to be done within 14 days. They were being done, but a lot of them were being done at 15 days, 17 days, 21 days. You've got to be less than 14 days or less to be compliant with the state rules. They are now being done around the day 7 mark, so they are way ahead. We've audited them several times, and that shouldn't be a problem. The other issue that cropped up, which was a concern to me, was there was a cap on their outside medical costs, including medications. On the original proposal, that cap was $51,300. In other words, HP will cover all of the costs up to $51,300. When you hit your $51,301, we start paying that. Both HP and us felt like we would stay real close to that cap, and we probably wouldn't hit that cap. We anticipated not hitting that cap till 11th month, maybe 12th month, somewhere around there, or maybe not at all, because there is a clause in there that contract that if we did not exceed the cap, if their cost didn't exceed the cap, we would get 90% of the savings back, rebated back to the county. So we were all looking forward to that. We found at month 7 we have now hit the cap, which means the next 5 months, every bill that comes in for medications and things, we're going to be on the hook for. I've already had conversation with Mr. Bott about that, and we can cover that, but we were concerned about the 7 months, so we dug back into this to find out why we hit that so quickly, and I'm going to ask Elaine to touch on that, but basically it's they inherited a lot of program costs that they had to wean away from. Inmates that are on certain medications, you just don't stop them because it's not part of our preferred medication anymore. You have to wean them off that or finish them out, and there were some unexpected costs that they dealt with, but if you look at the costs on the first page, you can see that the medication cost with the new program is less than half of what we were paying in a 7-month period. Outside medical services, again, about half. Dental, I mean, there's a lot of cuts that they've already, or controls that they've already put into place that I believe are going to hopefully take us back to where the cap is. But with that, I'd like to turn it over to you if you have any comments or if you have any questions for either of us, please.
What I'd like to say as far as the cap goes, our goal is to keep you below the cap. If you aren't happy with what we're giving you, then you won't use our services. So our goal is always to remain below that cap, to refund money to you. That's monies that we're hoping that we can give back to the county to apply towards the contract for the next year. In this particular case, when we did come in, we tried to base the cap on figures that have been given us on what has been costing the jail to run their medical department prior. And we also take into account what jails of similar size are presenting with bills. What are we looking at? Another jail very comparable to yours. What are we seeing with their inmates? What are their normal bills running? Are you running way high, way low? Where do we see it? What we've discovered when we came in here, as Captain had said, we inherited a lot more than what we had knowledge of walking into. We've put into place to try to keep as close to this possible cap as we can for the remainder of the year, is we've gone into an agreement with your local hospital where we're now getting discounted bills. We are now changing how we are actually going to submit the bills. For example, before, if a person went into the hospital, the bill automatically became that of the jails. What we're doing now is we're not processing our portion of the bill until we can see if there's any possible way to get this individual released from custody. And if that's the case, then that bill now becomes his. We've now also put into place where if an individual is our problem, he is going to remain in our jail, and we cannot get him released to make that bill belong to the individual. we're trying to see if there's any way we can get Medicaid forms filled out. And what I've done is our nurses are now trained in to take those Medicaid forms when that individual comes back from the hospital, because the hospital is technically supposed to get those forms filled out, and unfortunately they don't. They have a history of not doing that. They go to the path of least resistance in payment, so of course that would be the jail. But when that individual returns to the jail, we get those forms filled out and we submit them to attempt to see if Medicaid can pay that bill. We've taken all of the medications. The highest, largest portion of your bills so far have been medications. We put forward a formulary. We put that formulary in place. That is a formulary that is used. It's very similar to many of your insurance policies that you have. It's the least expensive of a medication that's just as efficient and works just as well, if not better, than some of the newest, latest, greatest, most expensive medications. The biggest problem that we found when we came into the jail were psychotropic medications. The amount of inmates that were on very, very expensive, to the tune of $300, $400, $500, $600 a month medications just overwhelmed us. We have a program that is nationwide with our psychiatrists, psychologists, social workers, where we deal with psychotropics and the mental health needs of prisons and jails, again, nationwide. We're very, very careful in what we use for medications. We're very careful in how our screening is done for who needs medications. And the jails that we have our programs in, it's a moot point because the costs are very, very minimal. An inmate has a history of coming into the jail and saying, yes, I was on mental health medications before. When we do a background check, we find that he hasn't seen anyone in mental health maybe for the last 2 years. But of course, now he's in jail. He doesn't want to be here. He wants to sleep. He wants to just kind of float through as best as he can on whatever he can convince us he needs. These inmates we see interacting, eating well, watching TV, playing card games, not posing a problem to the jails whatsoever. But these are the inmates that are constantly requesting to see mental health. Unfortunately, we don't have much control over that in here in this jail, in this particular jail. So after a certain amount of requests, we are obligated to turn over to the social worker for her to review these inmates. They will come in and give her a complete different story as to how their jail interactions are going. She will put them on the list to be seen by mental health. Now again, I want to stress to you, this is an inmate that is not on any medication whatsoever and doing exceedingly well. If he wasn't, we would have known right away that he was not. He's taken over to the mental health department and comes back with a laundry list of extremely expensive medications. Where we do not have control over mental health needs of an inmate in a jail, we require that if a medication requested is not on our formulary list, that the doctor prescribing fills out a form and tells us why he is requesting this medication that is non-formulary. Now, I'm talking about medications that are going to cost the jail $600 and $700 a month. The doctor can then fill out the form, give us the reasons as to why. The form is sent in, it is reviewed by a panel of his peers or her peers, whether it be medical needs or mental health needs. And a determination is rendered at that time as to no, that medication is not needed. We're requesting that you choose another medication, or we can choose one for you that is with our formulary. We're kind of at a standoff with mental health right now. They're refusing to fill out the form. If they do fill out the form, there's been several times that the refusal has been given to them and asked, please give us a different medication, we'll be more than happy, or we will be glad to supply a different medication, and it just is not filled out and not sent back. Or they're digging in their heels and they're saying that no, this medication must be given to this individual. We are believing that he is truly psychotic. I base my decision on my nurses and on the COs that deal with these inmates every single day. that can tell me what does this inmate look like? Is he of true need? If he is, we do not hesitate. If he is showing signs of a true disability and causing problems in the jail, is a harm to himself, or he's costing the jail more in time because he's so psychotic, we don't hesitate. Those medications are given to that individual. But right now, we are kind of at a standstill and a standoff with mental health. Many of their medications, they cannot give us reasons as to why to give them, so we are denying them. That's why one of the biggest reasons you'll see a dramatic decrease in the cost of your pharmaceuticals. We, again, are trying to work with the jail. We are trying to work with CMH the very best that we can. You also have a contract with a psychiatrist that comes in to the jail, a separate contract. She has tried to work with us somewhat. We're managing. She's managing. We do have odds at certain times, and that's the very, very best that we can do. But our goal right now is to truly try to keep the cost at the very, very minimal that we can possibly keep them. What I'd like to do also is to possibly take a look at our cap limits and to see if perhaps we should not change them for next year, but to see where we truly stand in the next few months.
The issue with mental health is an issue for another time and another discussion. We have tried to intercede the best we can. I personally know that mental health has told me an individual in our jail was not mentally ill. Next thing I know, he's on a very expensive medication to about $400 a month. And I said, "You told me he wasn't medically ill or mentally ill. What's going on?" "Well, it helps him sleep." And I said, "Excuse me." No. But that's the kind of issues we're running into.
Dennis?
Yeah, I'm aware of these issues. Greg Paffhouse has asked for a meeting, and we're in the process of scheduling a meeting with Greg. In terms of full disclosure, I think it's important to note that HPL has also proposed in the original bid to do mental health services for us. And they have the ability to do mental health services, so I just wanted that on the table. But I do believe that what's being conveyed to you is a accurate representation of the issue that we have with mental health. And I'll be meeting with Greg and with the staff and his staff to go over this issue and to try to bring some resolve to it. The thing that makes this a more difficult issue is that, to this point in our interpretation and so far in Greg's, his mental health providing services to our jail are part of their contractual responsibility under our agreement to give them $682,000 a year for mental health services. So it's not as simple. It might seem that we could just say, well, let's switch and go to another service provider, and that may be our solution in the long term, but we have to recognize that we're getting some level of mental health services at no additional cost, and we would have to negotiate the terms of that contract or reevaluate terms of that contract. So those are all will be the things that will be discussed with Greg and his staff here in the next week as soon as we get this meeting set up.
And if you recall in our presentation back in February when we recommended moving to HPL, we recommended staying with our mental health component and not using HP's component because we had a contract for mental health services and we had a psychiatrist in place, and that system is still working, but it does have some conflicts.
I guess, Bob, I'd have to disagree when you say that the discussion with mental health is a different discussion, because I believe it's an ongoing discussion. You know, everyone in this room knows that I've complained for years about the services in our jail by our Great Lakes Mental Health. And again, I remind everyone that we pay them $682,000 a year. You know, that's a significant amount of money. We've complained for years about the services that are provided in the jail, how minimal they are now compared to how they were 10 years ago, or you know, we had 40 hours a week in there 10 years ago, and now we're lucky to get, you know, a tenth of that. So, you know, in this ongoing discussion about the medications and the cost of these psychotropic drugs, And, this is a matter that we just have to hold mental health's feet to the fire and see if we can get through this, because, it's not going to get any better unless we say, okay, look, until these issues are resolved, we're going to withhold our appropriation, because I think the only leverage we have against them is the financial contribution that we make to mental health. Because we've had dozens of meetings with Greg and his staff over the years, and we still cannot get past this problem with them providing mental health service in our jail. Larry?
Dennis, who will be present at that meeting?
Well, I'm not sure who, excuse me, I'm not sure who on behalf of the mental health agency, but it will definitely be Bob, and I imagine a representative from HPL. We haven't decided that yet. Perhaps the sheriff and the undersheriff, myself. Perhaps Bob Cooney. We haven't finalized that yet.
I'd appreciate knowing when that meeting's going to be held.
$682,000 is a lot a year. It was probably a lot when you approved it, too. I had a couple questions for you, Captain Hall. First of all, the $51,000 cap, tell me again what goes into that, which of the listed things, the medications, outside medical services?
Yes, and dental.
And dental, okay, all right. Secondly, when we're looking at kind of the cost analysis that you did on the first page of your memo, really, HPL's cost, Dennis, we're more interested in what our cost to HPL is, which is the $216,000, as compared to what our 7 months were under our management of it, which was at $242, correct?
Well, I believe that they're trying to show you a comparison of how our old system compared in cost to the new system.
Sure.
And I think that's a relevant comparison. But what's not included in here, of course, is what the unknown cost for additional medical will be under this contract for the last 4 or 5 months, and that certainly will impact that number as well, in that comparison as well as what we budgeted. Actually, what we have budgeted here, we're still making up some of the difference in this budget. We're still a little bit short of making up that difference. So, but Dean has talked with Bob and feels that we'll be able to cover it through the year.
So the reason that you put the middle column in there was kind of to show the costs that were going to the $51,000 cap, right?
Yes.
Okay.
Yes.
Okay. And then what were our projected savings in going to subcontracting to HPL?
There was no projected savings. If you recall, the original projection showed that going to the managed healthcare was slightly higher than the in-house program. But the benefits, the reduction in the liability, the professionalism of the operation, and the support of all the operation, we felt was in the best interest of the county.
And I think the cohesiveness of the operation.
Yes.
And in fact, if you think about it in terms of the mental health services, it's the one aspect of the service that is not part of the cohesive service. So that's where we have some work to do.
The other thing I would like to request, if you could send a copy of this report that's included in our packet, if you could send a copy of that to Greg Paffhouse, as well as a link to this meeting, and send it to him and ask that he copy all of his board members at CMH.
We can do that.
Thank you.
Ross?
I'm sort of asking the same question Beth has, I guess. So when we look at that middle column on the first page, and it talks about the medications of $11,000 and some change, and outside medical services of $37,600, and then the small amount for dental. All of that is being applied to the $51,000 cap, and so we're almost there, basically,
Yes,
after 7
correct.
months. And once we go over that, then the county is
County pays
responsible for everything above that.
Yes, sir.
Okay, and then the biggest issue is there an issue with the outside medical services, or is it mostly with the medications that are being prescribed by CMH?
Originally, with the outside medical services, when we took a look at what our costs were, that's when we decided that we needed to do something as drastic as we possibly could to reel the costs in. We have to send the people out. I mean, it's not that we're just sending them out helter-skelter. We take a real careful look. Anyone that's being sent out, for example, if someone comes in and says, hey, I had a doctor's appointment to have surgery on my hand, but now that I'm in here, it's your responsibility to pay for that. What we do is we request his medical records, they're sent to our review board. Our review board determines then if that's a surgery that has to be done, or can it wait until the individual is released. When we sent them here to the hospital was charging full rate for hospital bills. We've now recently just signed a contract with them to give us decreased 20% on all hospital bills and all hospital services. We're also really reviewing, again, as I said now, instead of notifying the hospital that this is an inmate we're sending over to the emergency room, we're trying to get our paperwork with the jail as quickly as we possibly can humanly do, if it's not a true call an ambulance type emergency. But is this person going to be released? Can we get that paperwork done as quickly as we possibly can? And we put the wheels in motion to do that. So those outside medical services, we're expecting to see dramatically drop. So that's what we're looking at.
Commissioner, I think to answer your question, I think both those areas are areas that are being targeted.
Right, okay. And then, so the little question marks are things that we don't need to concern ourselves with because they're part of the contract.
That's
and
right.
There's no,
They don't go
there's no
toward-
overrun for the county or whatever,
No.
right? And then, of course, the medications, it's mostly that doctors who do not work for HPL are prescribing things that we have to pay for.
Right.
Okay.
You know, and what's really interesting is when we talk about medications, is it always comes back to the discussion about psychotropic medications. It always comes back to our mental health patients and what percentage of them is in our county jail. What percentage of our county jail is under treatment by mental health?
If I may interject just one thing, just to give you an example, for the last several months, when we first came on, it was absolutely amazing to me, because I review all of the bills, to see that your bills for medication was approximately $1,000 a month, but your psychotropic medications were over $2,000 a month. So that was just amazing to us.
Dennis?
I'd just like to get your opinion. It's a little alarming to me to see, and I know our population has gone up, but on page 4, the number of sick calls seems to have increased dramatically each month since you've taken over. Can you give some kind of an idea of why that would be?
That's an interesting concept as well, because all of your inmates are now being charged to be seen by the medical department. We are obligated to see an inmate if they request to be seen. So the inmate may be seen 6, 7 times by our medical department for 1 complaint, 2 complaints, or several complaints. They've really cut back, and it's strange because the medical staff will also just go cell to cell giving out medications and address many of the foolish issues at that time. But we seem to be seeing an incredible ill population coming in. These people are truly ill. They have to be seen for withdrawal. They have to be seen for withdrawal from narcotics. And they're seen multiple times as they're becoming sicker and sicker. And it seems the acuity of the population that you're having come in the last few months has just been very, very amazing. We're seeing a lot more flu-like symptoms. We're seeing a lot more chronic conditions that have not been treated on the outside that they're coming in with. And we kind of attribute that to the lack of health insurance. So people that might have had a little bit here, a little bit there to get medications to take care of themselves, they truly aren't. They aren't doing anything for themselves, even for that smaller population that we always saw in the jail. And now they're coming in and they're having to be addressed.
If you can imagine any illness or disease out there, it comes into the jail. MRSA, we've had it for years, people in and out. Heart conditions, severe allergies, cancer, we have to deal with them all.
Next month, we'll report back to you on our progress with mental health after we've had the meetings with them.
My recommendation at the very end was to continue where we're going. We're making progress in all areas, and to review it at the end of 1 year and get a better handle as to where we're at with all controlled costs and the program.
The renewal on this contract, or this contract would be in March, right? Would be
No,
the
it's a
1
three-year contract.
Right, but it was 1-year review would be in March.
Yes, yes.
Ross?
And it would be safe to characterize that you're, generally pleased with the switch to HPL from where we were before, that things seem to be run in a more professional manner, and you have better control of what's going on with medical care in the jail.
Yes, we are. We're very pleased.
Bruce?
I would move that we continue with the recommendation of Captain Hall.
Motion by Hooper, do I support by Thomas, to continue the continue the medical services program in the jail. I guess I'm not sure if we have a 3-year contract, why we have to,
I don't think we need a motion. That was
reaffirm it
just
now.
a
It was just an
informational
update as
report.
to where we were at.
Well,
Sorry?
Just to reiterate,
Yeah, I'm, we can vote on the motion if that's what we want, but we have a 3-year contract in place, so I'm not sure that we need
I
the
can withdraw the
motion.
motion.
Okay, thank you. You need to withdraw the second?
no, vote on the second.
Do it to the motion. Leave Mr., don't wake Mr. Thomas. Okay, anything else for us this morning, Bob?
No, sir.
Thank you for coming.
Thank you.
The drama continues. Next, we have the Health Department. Good morning, Fred.
Morning. We have 2 items of discussion this morning. One is a program called Shaping Positive Life Styles, Attitude to School Health, which has the acronym of SPLASH. This is a program that the TBA ISD program has, I don't know how many years they've had this, but they are in need of nursing time and want to contract with us for that, at a rate of $45 an hour, not to exceed $36,000. And so they are proposing that we add on a .4 FTE person through June of 2011, and that would be an internal person that we would just add their time on to a part-time person.
Larry?
I would move that we approve the contractual agreement as presented, contingent upon the review and approval of Al Schneider, prosecuting attorney.
Support.
Motion by Fleece, supported by Richardson.
And
I
always,
guess-
question.
Go ahead.
Dennis, always when we approve these, I'm assuming, have always assumed, sometimes we've specified, most of the time we don't, that those increase in the FTE is solely based on that program. I mean,
Yes.
if we lose.
If it wasn't, we would identify that to you.
Right.
And that FTE portion, or that portion of FTE is included in the current staffing plan and with this current staffing?
No, Jen will actually come in next week with an increase in staffing plan
Okay.
to address
Well,
that.
that was the other piece of this, is
Yep, right.
whether we had to go hire someone else or if we had staff in-house.
We
that
always
would
act
do
on the
this.
contract and the committee, which the department represents, I know it seems crazy, but we always do the staffing plan as a part of RMA with HR.
Right, okay. Ross?
I had just 2 quick questions. What's EPEC, EPEC? It's in it says a PE teacher to complete and implement EPEC in K-5 classes.
Kit Mikovits, Personal Health Administrator. I believe it's an acronym that has to do with the physical education portion of the training.
Okay.
This person is going to work as a liaison with the schools to help with nutrition and education, increased activity.
And how many participating schools do we have?
There's 10.
10 in the county?
No, they're outside of the county. This is the intermediate school district.
Oh,
So they're outside of the, some are in the county.
some are in and some are out, okay.
Correct.
All right, thank you.
There is one issue under section 4.1, is that a contractor shall indemnify and hold Traverse Bay Intermediate School District harmless. That's not acceptable with our attorney, and they're reworking the verbiage on that, and we'll go back to Al Schneider's review then.
Any other questions? We have a motion to approve the contract with the Traverse Bay Intermediate School District for 4/10 of 1 FTE at $45 an hour, not to exceed $36,000. Any further discussion? All those in favor say aye.
Aye.
Opposed, the same. Motion carries.
The next item has to do with the WIC of breastfeeding peer counseling. As part of our contract that was already approved for the state was the addition of this breastfeeding peer counseling program, which really initiated October 1. We held off because of the very issue of our reorganizing before we were going to initiate any new programs, and now that we're comfortable that we can start that. This is a program that WIC initiated, and we would get paid $97,500 for this. This includes a full-time peer counselor. This could be one person, or it could be bifurcated with two people or more, that are actually people who have breastfed, and they would be hired as a peer to work with women as they go through pre-birth of the baby and afterwards of issues of breastfeeding. And then that also includes a quarter of a registered dietitian and a tenth of an FTE of a public health nurse. The latter two parts would probably be filled internally, staff, but we may have to backfill those positions. That is, if it creates a vacancy, we have to increase another nurse by a tenth and a dietitian or a nurse by a quarter. But the one FTE of a peer counselor would be a new position. It's anticipated, this is for 1 year, but it's anticipated that WIC will continue this through their program with us.
Fred, what is the time frame on this grant? Does it go
This
through
is our
2011?
contract
or-
that started October 1 through the end of September of 2011. And it's anticipated that it'll be statewide and continue on from this point on by the state.
Ross?
I move that we approve acceptance of CPBC contract funding in the amount of $97,500.
Support.
Motion by Richardson, supported by Inman. Further discussion? Ross?
Do we have any statistics on, well, you must have some statistics on, WIC participants who are breastfeeding or not breastfeeding?
I think, last I recall, I think it was about, at 3 months, about 65% of our WIC clients are breastfeeding. So we actually have one of the highest breastfeeding rates in the state.
But this will obviously, hopefully, both increase that number and also how long they continue
And how
to do
long
it.
they keep breastfeeding, yes. I mean, the kind of philosophy behind this is that this is to reduce the amount of formula that's given out and to promote more breastfeeding, because it's better for the baby, it's cheaper for the federal government, and it's a kind of a winner all the way around. It's just the acceptance of breastfeeding.
I have a question. Kit, will this fall under your responsibility? I mean, will this fall under your umbrella?
It will.
Okay, and it makes a lot of sense just for the reasons that Fred just mentioned, health of the child and the parent and the economic,
Right.
sense that it makes for, particularly for people who are struggling, anybody really. But I do want to make sure that this program does focus on the best intent for the mother and child, which may not entirely be breastfeeding for every person who is receiving WIC benefits, and that it does respect individual choices and individual medical concerns that may not lead them to using a lactation consultant.
I agree totally.
Okay.
That it should be an individual choice. Just help people overcome barriers if they truly are going that way, that we can help them overcome barriers. But you're exactly right.
Okay, thank you.
Further discussion? Motion to approve, say aye.
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 Opposed, the same. Carries.
Thank you.
Okay, that brings us through Health Department items. Was there any unfinished business to come before this committee?
Beth had an item.
What did
She
you
added to
want
the
add
agenda.
that?
Oh,
I'm not sure we added it.
the bid for the health
Right.
insurance.
Did you want to do that now, or?
Or
We
the
can do
agent
that now,
record,
yes.
Oh, okay, well, you should have gotten a memo that talked about the RFP for employee benefits agent. And I was just following up on a question that I heard at the last meeting with respect to the minimum qualifications in the RFP, where it outlines that at least 5 years' experience with a public entity, including experience with one entity that has an annualized health insurance premium over $3 million. So I started looking around and calling some, other counties, other quasi-governmental agencies, in our general area, Wexford County, Leelanau County, Beta, those types of things. And, they don't even come close to approaching $3 million in annualized healthcare premiums. I understand the intent of this was to make sure that we had qualified candidates, but what I don't want to do is set a threshold where we may have somebody who applying who has, $2 million account, and how do we leave them out when it isn't $3 million? So I'm just suggesting, as it says on the bottom of the memo, that we possibly change that RFP rather, to provide a list of their top organizations in which they serve with health care, along with their premiums, so we'll know how much they are, and a contact person for each of those organizations, as well as the same thing for those public entities in which they serve. So what I would like to do is change that RFP, resubmit that RFP, and any sealed bids that we've already received or received by Friday, that we send those back unopened with information changing, making them aware that we have changed that minimum requirement in the RFP.
Is that a motion?
I would. So
I guess.
I would move that we would change the RFP to delete the current minimum criteria of the $3 million annualized healthcare premium, and to change it to some of the suggested verbiage on the bottom of the memo or something very similar, and to reissue that RFP and return any sealed bids that we do receive.
I'll support that.
We have a motion and a second. Jen, I guess what I'd like to hear from you is why the criteria that was put out in the RFP was there.
Oh, I felt as though we needed someone that could negotiate a $5 million healthcare. Our bid for healthcare is $5 million. That we needed someone that could negotiate a large amount for us, as well as handle our large book of business. To be honest, we've got with $5 million comes over 500 employees and their dependents, which takes us up to 1,400 citizens in this county that could be calling our agent, and they need to be able to respond to that many people and have the ability to service a large account. And that's where that came from. We had debated, should it be $2.5 million, $3 million? It was put there so that we could get someone that had the qualifications necessary to handle our account. That was what it's for.
Dennis?
When we put bids together, we try to evaluate the bid proposal in a way that will make sure that we have reason to believe it will be a competitive bid, and that we'll get adequate response that will give the county the best value for its dollar and the taxpayers the best value for their dollar. We had received inquiries from 7 or 8 different agencies, large agencies, that deal in public and private insurances, indicating they were all interested in bidding. And I think, in fact, we sent 8 out, is that right, 7 or 8 out?
More than that.
To agencies that requested it.
Yeah.
We also sent it out to many local agencies to make sure that it was as available as possible. We have every confidence that we will get multiple bids in this, and that they will be good bids. From conversations that I've had with people inquiring about the project, we think we'll get requests from agencies that work with municipal governments, with counties and cities and townships, and have experience working with large books of business. So we feel confident that the bids will be appropriate. I wasn't aware until I received this letter late yesterday afternoon. As purchasing agent, I didn't realize that there was a problem with the bid proposal that we gave you 2 weeks ago. Your rules state that it's under the purchasing policy, that it's the department head in consultation with the county administrator that develops the bid specifications for bids and that puts those bids out on behalf of the county. And I would recommend to you that you allow the bids to go as they are, that you allow them to be evaluated. Jen is putting together a plan to have some independent people evaluate the bids and assist you. And then if you're not satisfied with the results and you don't find somebody that you feel best serves the needs of the county, then you could direct us in another direction to go out with a different set of specifications. But I'm very confident that we'll get good bids, and I'm very confident that we'll have very capable bidders. Frankly, to open it up and to broaden it, to me, sends a message or gives a message of false hope to some smaller vendors that may not be capable, but will have expectation because of the fact that they're in the county, perhaps, that they will get this work. And so I look at it a lot like when we look at our accounting services and our auditing services. We don't send those out to everybody. We put thresholds on those because we want somebody who's capable of handling an agency similar to ours to make sure we get the best and most efficient service. So we don't send it to the 1- and 2-person auditors and offer it for them to do our audits, for example. And the same we think holds true for insurance. So I do have the part of the purchasing policy here that if you want to see it, that indicates it's the department head and the county administrator that establishes the scope of work and the bid specs. And again, my recommendation would be that we allow this to run its course. We will bring you a recommendation that will have some independence to its evaluation of these bids. And if you're not satisfied with the results, we can always put them back up.
I guess, if you don't mind, gentlemen, my comment is going to be that I will not support the motion. I, too, got Beth's memo late last night when I read my email for the day. I believe we had the bid specifications a couple weeks ago. No comments were made about, the bid specs at that point. They've been distributed. Bids are being solicited. Bids are to be opened, I believe, on Friday. Let's run the course. If we don't like the bids we get, we have the ability to reject any and all bids. So, I really don't think there's a reason to stop the process at this point. We can always, if we don't like the bids that we get, or we think that there's other bidders out there that would be more qualified at a better rate, we can rebid it. Ross?
I am the one who raised the question at, I guess, the meeting last Wednesday, about the $3 million threshold. I will support the motion because I don't see that there's any problem of opening it up to more potential bidders. If we don't like the bids or we think the offices are too small or incapable, obviously we have the power to reject the bids, but I don't see why we need to, limit ourselves going in. As far as false hope goes, I mean, anybody who bids on a government contract knows that they're bidding against a lot of other companies and individuals, and they're just going to have to hopefully have the best qualifications to get it. And the problem with opening up the bids this Friday is that now we know, everybody knows what the bids are, and if we rebid that, in a way, there's more information out there for anyone who bids a second time. So I don't think it hurts us to, expand the field, maybe extend the bid period for a week or two and, see what we get.
Larry?
Well, my understanding of the agent of record is that we're basically making a decision on who we feel is most qualified and who we most trust to do the best job for the county in terms of negotiating our annual bids as well as servicing claims. My understanding is that the insurance company actually negotiates the commission with the agent of record. So, the threshold situation, I guess I could have taken or leaving it really in the original RFQ, but I guess at this point I just would not shift gears and let the process go through. Let's see who comes forward and see who qualifies in terms of, company strength to manage our process. And then we don't like the number of applicants that have met that criteria. We can always go out and do it, but I don't see this as a bidding war. I see this more as a qualification in terms of who we think is best suited for their organization based on staff levels and experience to manage our account. So I just soon let the process go through and let's look at it on Friday.
Larry?
So.
I'm surprised at your response that you wouldn't support the motion, particularly being a business owner. If an RFP was put out and it had a dollar amount, you must do, Wheelock and Sons Welding must do $5 million in a specialized welding deal or you can't bid. I think that'd really be a detriment to your business. It'd be no different than my business. I'm not allowed to bid on lawnmower equipment because I don't do a certain dollar amount or one of my competitors don't. I'd be very much opposed to that. This is America, and I don't have a problem with this RFP other than the dollar amount. The 5 years experience, that right there in itself should tell you something. If they've been around for 5 years, they've probably been around for a while. I think we need to do exactly what Beth is suggesting, and I agree with Ross's comments and Beth's. I think we need to send the bids back that we've received with the notation, take the $3 million out, the dollar amount, because that's really an immaterial. That's an arbitrarily and capricious statement to make in an RFP, in my opinion. I don't see where a dollar amount in my business, Sonny's business, the insurance business, how many dollars you do volume of business has got anything to do with an RFP and the level of service and the expertise offered by a firm. You could have some small firm out there that really would give you a lot better job at perhaps a lower cost, and they're excluded because of the $3 million. And I'll tell you a short, quick story, and I'm not going to name any names, but years ago, like 30 years ago when I'm first in business, I didn't know any CPAs. I went to a very reputable firm, nationwide firm, and I discovered after a short while with them that their expertise in just a simple matter like sales tax exemptions, they didn't know anything about the discounts. And the guy, the CPA told me, he says, well, I think you're wrong. Well, I suddenly left that firm, and I went and found a mom and pop firm that serviced me well for many years at a much lower cost, and they knew all about the discounts through sales tax. So the size of a firm really has nothing to do with it, and I think you're excluding a lot of people at the 3 million benchmark. The 5 years is fine. I don't have a problem with that because that shows their commitment to stay in business. But I think we're excluding a lot of people, and I don't see the harm with sending the bids back and extending it another week or 2 weeks or whatever, and let anybody who wants to bid on it.
Well, Commissioner, you were the one who called Jen and specifically said, the day after you made the motion, I want these bids out in the next 2 weeks. You were the one who wanted this thing moved forward. And so we're trying to move it forward in an expeditious manner. I take exception with your comment about capricious. Capricious means a sudden change of behavior. This is not a change of behavior. We always bid, and we always bid to a target to meet the size of our organization. And so this is consistent with what we've done, not inconsistent with what we've done. And in terms of your example, without naming names, you may be absolutely right. The big firm may not have been an appropriate firm to deal with your business at whatever your volume of business was. But we're talking about a county with a $150 million budget and a $5 million account. Not just any mom and pop with 1 or 2 employees can handle that volume, including the 1,400 employees that they have to deal with issues that they have with their insurance coverage. So we think this is a different animal. And, you know, if we take off our requirements or our work scope, our scope of work parameters on all the bids that we do, you're going to be sitting here, either you or your staff's going to be sitting here sometimes with 50 and 100 bids to go through to try to determine subjectively which ones are appropriate and which ones aren't. And our advice to you as your staff is that is not a position that you want to be in. We understand that politically it's good to let everybody have a shot, but in terms of someone realistically who can do the work, the only way we could make a decision on a small firm to do that work would be to make some subjective judgments on what that firm's capability is, not base it on past experience and volume of work. And I just think that's not wise for you to do.
Dennis, you said a mouthful when you said subjective. I submit to you that 3 million is pretty subjective. And unless you've been on the other end of the table, it's just like our radio bids here in the county. I don't recall very few bids that we put a dollar amount on and that a company has to do a dollar amount in order to bid. And I don't think that's a good representation of the constituents of Grand Traverse County, that we eliminate bidders.
It may not be when you're talking about equipment purchases, but when you're talking about capability to service a client population, that you have to have some reasonable stipulations of what makes sense to look at. You can't take a $5 million contract and add with it workers' comp, dental, liability, which we have all through our agent, and you can't take that and you put all that on somebody who says, I've done $2 million of business with this person or $1 million of business with this firm. It's not the same. You know, they may have done $1 million of business, 500,000 of that might be liability. Okay? We're not even talking about liability here. We're not talking about property. We're talking about medical, and we're talking about 1,400 more employees that they will have to service on a daily basis. You can't just turn that over to any firm.
The premiums in the health insurance programs in this country have jumped substantially. So, for example, the $3 million in this RFP, even 10 years ago, would have been totally unrealistic because the premiums weren't that much. And perhaps in the future, the very near future, $3 million would be totally inappropriate because the figure we're looking at, instead of $5 million worth of business, may very well be $15 million.
But
so I think the dollar figure is just a wrong
But Commissioner,
measurement.
the $3 million that we use as a threshold here compares exactly with the $2 million or the $1 million or the $5 million that any agent is servicing now. Next year it might be $15 million, but then our threshold might be 12 or 11. I know you don't agree with it, but that's not an argument that is logical from the standpoint of comparisons. Comparisons right now are comparisons with today's numbers. They're the same for everybody. Now, 5 years from now, they will be a different number, and probably we would have put a different number in this RFP.
You know, Dennis, the state doesn't even have that type of criteria in their RFPs. And I'll give you an example there. For example, they wanted some bids on some equipment one time. And I bid, and the bid come in at $150,000. And to suggest, if the state had had a threshold that you must do $3 million in business, I would never have been able at that time to even bid that. And I was fully capable, and I got the bid.
Well, Commissioner, as I said to you earlier, you may not have heard it. We're not talking about equipment bids here. It's different.
It's still a service, is it not?
One is a service, one is equipment. It's
No,
different.
no.
There is a difference, Larry, and we're going to move forward. Beth?
First of all, the reason for the timing of this is just the next logical meeting after it was brought up a week ago. So there was no delay in trying to submit any memo. It's just simply the next available meeting after it was brought up last week by Ross. The other thing is, too, with respect to offering our opinion and judgment on an RFP, I think it's completely appropriate. We were just given the outline for an RFP for strategic planning and budgeting for outcomes and asked, what our thoughts were on that. So I don't think that is uncalled for. The other thing about the premium level that makes it particularly difficult, when I was talking with a lot of these different agencies and entities yesterday, so many of them are going with a low premium, high deductible, and then they are self-funding for the difference. So that makes it even a little bit higher of a threshold to meet that they may not meet. I particularly called governmental, quasi-governmental entities and agencies yesterday, or organizations yesterday. I did happen to talk and network through to an agency that I had a brief discussion with them, and they actually, I did not realize this until later, I think are intending on submitting a bid, and they qualify under the $3 million threshold, and they suggested that it should absolutely be taken off because of the size of some of the business in our regional area.
Larry?
If you could give me an example, Dennis and Jen, of, we have a $5 million account, and the threshold was $3 million in the bid, the request for proposals. So would that equate to about an agent, an agent handling, 200 employees for a company, or, what, give me an equivalent or a best guess at number of employees what that would be relevant to. About 200?
Well, it's 60%,
What is
so if we've got
Sure,
500, 60% is 300.
If you want to do, ours is $5 million, we have 550 employees, so if it's...
So we would be looking
If you
at,
want to do an assumption, it's hard to say.
so we would be looking at a company
Exactly.
that has serviced,
No, a public organization.
we would, okay.
Yeah. And the reason for public organization is simply because of the 12 labor unions that we have to deal with. There aren't many private sector companies even that have 12 labor unions. that
So
they
we
have
would
to
be
deal with. And
looking
that's- That in itself is problematic because of the way you have to design the programs to be able to meet the contract obligations that we have. So we think it takes some expertise in that area in order
So
to be able to.
most likely, we would be looking at agents that have serviced I'm assuming publicly funded or governmental? Is it publicly funded?
Public entity.
Public entity? Okay, so they would be, they could potentially, could have serviced the college,
Right.
the hospital,
Right. Yeah. Doesn't have to be
public school
governmental.
systems,
Right.
counties, those kinds of things.
Correct.
And if you're only looking at an entity that served only 200 employees or 300 employees, I don't think that's unreasonable.
Which would not be any of the counties around us, by the way.
Well, I don't know about that.
Nope.
Oh, no.
She checked.
I don't either. I believe Cadillac Insurance has a couple of the counties around us.
Cadillac Insurance does have some, they have Wexford County. Wexford County doesn't even approach $3 million.
But they have other
They do
counties that are
have
above
other
that
counties,
number.
and what was the ratio that they gave me? Not even, many of those don't come close to the $3 million because they are going to the lower premium, higher deductible, then their premiums do not reach the $3 million. For a lot of the county road associations, a lot of the counties, a lot of the CMHs,
That's
those
right.
types of things.
But what we're saying is experience and a $3 million book of business in the last 5 years, and I think that they will certainly meet that. We want you to also know that when we did this, we took RFPs. We asked across the state for RFPs from other county agencies. We received a number of RFPs. Most counties, believe it or not, don't bid this out. Most counties just pick an agent. And so this is a little bit unusual, but of the ones we found, many of them had thresholds in them, and we kind of looked at the average thresholds. In fact, this is language directly out of one of the ones of a similar sized county to ours.
But specifically, you're asking not for a book of business of $3 million, you're asking for one public entity that has a $3 million annualized deductible, one account.
And that's exactly what the RFP says, and Ross brought that up last week, and I thought about it, and I thought, by gosh, he's right. And that just arbitrarily excludes a lot of firms, period. Because it says at least 5 years' experience with public entities, including experience with at least one public entity that has an annualized health insurance premium over $3 million. And like Beth said, even Wexford County can't meet that.
Well, of course they can't, because they're much smaller than we are.
And-
I think, I want to go back to your purchasing policy that was adopted by the county board. The purchasing policy says it's the responsibility of department head, along with the administrator, to put the bid specs together. If we didn't feel that we would have adequate bids as a result of the bid spec we put together, we would not have put a threshold like that. We feel comfortable that we will get a significant number of bids that will serve the taxpayers of the county. If the county board wants to change that, which is what this motion does, I think you need to reevaluate the purchasing policy and redirect that the county board reserves the right to change bid specifications for county departments. Commissioner Friend, you mentioned the fact that we sent you the bid specs on the budgeting for outcome consultants. What we sent you there was a scope of work, and that's because that is your project, and we were unclear. We did not feel we had the capability of deciding what work scope you were looking for as a county board. So, of course, doing our due diligence, we sent it to you to ask you for comments, so that we made sure that what we designed was something that that would meet your needs. We feel very comfortable in this one that it'll meet your needs, and that's why we didn't do that. That was an unusual case to send you those bid specs.
Yeah.
And, I just wanted it to be clear. I know you had mentioned to Jen yesterday that it's not our decision. Well, in fact, it is really. Under your policy, it is our decision. And if you want to change that, I think you need to change it in the policy.
Excuse
I
me,
think the
mentioned it
message
wasn't-
that this
Wait,
sends-
what did I mention yesterday?
I believe you stated that it's not Jen's decision as to what
The
this bid
RFP,
specs
to
looks
take
like in the
out. It was
RFP.
not my decision to.
I don't
You
think I
guys voted.
specifically said that it was not your decision.
Well, I guess
I said that I would like to take a memo to the Board of Commissioners and that I would copy you on that.
I guess what I'm saying is it frankly is, and if you want to change that, you should change it in the policy and reserve the right of the commissioners to change any bid specifications that you're not satisfied with. Typically, what you do is you make that decision when you make a decision on selecting the vendor. And that's where the Board of Commissioners comes in this process. We put the bid specs together, we send them out, we bring them back, we make a recommendation to you, and if you're unhappy with that result, you say, no, throw it out. And you've done that before. But I can't recall a time where you've come in and said, we want you to change the specification and withdraw the bids and send them back out with new scope of work in them. That's not what the policy, that's not the procedure that we use, that you adopted. And if you'd want to, you really should reevaluate that whole policy and change that policy, because it has significant impacts with all your departments that bid things out.
I think the board has to accept the responsibility for maybe not scrutinizing this completely earlier. But in essence, what you're telling all the smaller firms out there is an advertising slogan that a company had. If you can't run with the big dogs, stay on the porch. And that, to me, is wrong.
Okay, I think we've probably had enough discussion. I guess the only point that I would make is that our policy is that we charge department heads and the administrator to solicit bids. They've done that. I believe we owe it to them to open those bids and make a decision. We have the right to reject any and all bids.
Would you repeat the motion?
Sam, would you read the motion, please?
I honestly didn't catch
Okay.
all. I'm
Okay.
Sorry.
I believe-
I
didn't
could
catch all
restate
of
that
them.
if you would like. It
Do
would
you want to restate it, please, Beth?
Sure, that would be fine. It would be to amend the RFP to remove the requirement of the 5 years' experience of a public entity with one public entity that has an annualized health insurance premium over $3 million, and to replace that with verbiage with the verbiage at the bottom of the memo that you received, or very similar verbiage, and to return any sealed bids that we've already received or would receive by Friday, notifying them of the change and resubmitting that RFP for services.
Everyone understands the motion? Roll call, please.
Commissioner Hooper,
No.
Inman,
No.
Max Bauer,
Yes.
Richardson,
Yes.
Thomas,
No.
Please,
Yes.
Friend,
Yes.
Chairman Wheelock.
No.
Okay, so I would make a motion that we would
Motion fails.
table this agenda item until the Resource Management Administration meeting for next week for discussion, where we would have a full board.
Can't
I
do
don't
that.
believe we can table after we've already taken a vote.
Yeah, Cooney has
You would
already told me
you
that
would have
opinion.
to bring forth next week a motion to reconsider.
All right, then I'll make a different motion that we keep the bids that we receive on Friday sealed until next Thursday.
Mr.
I think the
Chairman?
bid specifications specify that the bids will be opened at a time specific on this Friday, and we can't change
I
that.
think we already voted on that.
Mr. Cooney has indicated to me in my prior request for the issue of the landfill surcharge, he indicated to me that when a committee makes a decision and it fails, it cannot go for reconsideration unless, the only way it goes for reconsideration is if it's brought up in the same committee meeting. But if it's a different motion, then it can be considered at a different meeting or a different committee.
Well, I believe the point is that the bids that we have solicited will be opened on Friday, and we will hear a recommendation at RMA or at Ways and Means about the contract. Ways and Means, maybe.
Ways and Means.
I'm not sure when,
Okay.
because we want to set up a committee. We've got some volunteers from the public who have helped us in the past to look at these.
What does
Sounds
your
good.
RFP outline on the time frame of that?
2 weeks after the deadline to review the RFPs, so that would take us past Ways and Means.
Okay.
Very good.
So hopefully by the end of the month. Was there any new business? This brings us to the second opportunity for public comment. Is there anyone in the public wishing to make comment this morning? Any commissioner or committee reports? Chris?
You will see a letter on your desk, which Georgia passed out. She reported to the Commission on Aging Board yesterday on this. Georgia received, actually, MIOSHA received an anonymous complaint about some safety issues. And I just want to say Georgia's response was, I thought it was outstanding. The first thing she informed the board yesterday was that she was grateful that that these issues were brought to her attention, anonymously or otherwise, and because she is concerned and did see that there was, as she said yesterday, an accident waiting to happen, and now that accident won't happen. So I just wanted to make everybody aware of her response to this issue. The other thing that, and this really doesn't have anything to do with the Commission on Aging issue, Dennis, we had an incident last week with sulfuric acid being poured into the drain over at the pool. And as I told you on Friday, my concern is how we respond in the future to these types of incidents. I was there when, not when it was poured in, but I was there shortly afterwards. And I was watching members of the public being allowed to enter the shower room, and while an employee entered with a gas mask. So I have some concerns as to how we responded and how we might change our response in the future. And I would greatly appreciate some type of written report as to what your findings are or will be.
Commissioner, as I spoke with you several times over the week, we are in the process of getting the investigation completed. I expect I'll have that done by tomorrow. I'll put copies in all of the mailboxes of the commissioners so you can see that. I want to clarify, it was drain cleaner that was put in the drain of the shower room, not the pool. You said, the pool, but you meant the shower room.
I meant the shower room,
Yeah.
thank you.
And there were people who accessed it. Commissioner Max Bauer contacted the hazmat people of the city on Monday morning to report it. We had as well. They had not returned our call yet. But it has, just to alleviate any further concerns that the commissioners may have, it has been reviewed by the fire chief, Jim Tuller, who indicates that there is no policy regarding this incident, and the steps taken were the right ones. Their role is to assist in these matters as far as he's concerned. He's good to go with the facilities and the actions taken. Now, having said that, the investigation will show missteps on the part of some of our employees in the way it was handled, and we will be providing you with a report on that. Appropriate discipline will be issued, and training will be provided to make sure that those things don't happen again. But the end result of this, I think, will be positive, and we will learn from it.
Dennis, what was poured in the drain in the locker room?
It's a chemical called clobber. It's a drain opener.
Is it a across-the-counter?
No.
Can you purchase
Oh, absolutely
across-the-counter?
No.
No,
It's
it's
sulfuric
an
acid.
industrial drain cleaner
Most
that
of it
we
is.
use, that we've used in the past. Typically, what we do is we put it in the drain at 9 or 9:30 at night. This employee got some bad communication, asked the wrong person about who was in the pool, whether it was time, and thought he had a 2-hour window here, and he put it in at a time when the fumes were very noticeable. And I was there about 20 minutes or half an hour after the incident, and I was in the room, and you could still smell it, and we were airing it out. So we made a number of missteps in there, and we will be drafting up policies and plans to address those missteps to make sure they don't happen again. And I'm confident that we'll have a procedure that's going to be more clear and thorough. But according to the review done by the fire chief, he's satisfied that what we did in response to it was the appropriate response. There were things we could have done better internally to protect our employees and protect the public, and we'll do those in the future.
And the chief is,
Jim Tuller?
yeah, I know who he is, but he's the head of the hazmat team, would that be correct?
The hazmat team
City?
is under him.
Yeah.
So, we're just,
Larry?
I have a question of Georgia regarding what Commissioner Maxbauer was just talking on the complaint that was filed with Myosha. The employees, it says in this memo, were asked to purchase steel-toed boots and all have done so. Are these union employees or non-union?
Non-union.
Is there been any conversation regarding reimbursing those employees for the steel-toed shoes?
We talked about that, and we actually met Georgia Durga, Grand Traverse County Commission on Aging Director. We went out and met with them right after we got this complaint to discuss how we were going to address the 4 issues that were mentioned in the letter. And we talked about boots. They all wanted different kinds of boots. We provide them with a shirt or a sweatshirt and a hat and personal protective gear, and we decided that boots were something they should purchase on their own. They each wanted their own different kinds. Some wanted winter boots, some wanted not winter boots, and we just decided not to do that.
If I could offer a suggestion, perhaps under that circumstance where you have, a variance of the products that's going to be purchased that'll still meet or be compliant, perhaps we should give them an allowance. And the reason I state this, because if those were union employees, that would be an item up for negotiation, and it's like a police officer or a sheriff's deputy. They're not allowed to buy their gun for the service. The county purchase it because they want the uniformity, but definitely the union would be in a negotiating position for the purchase of those required items. So I think perhaps an allowance might be considered.
Okay, maybe we should talk about that, because we provide a lot of things for the employees. We provide uniforms and a lot of things, and we just decided that footwear was probably where we were going to stop it. We provide prescription eyewear, protective eyewear, and things like that. So we just felt like footwear, if we did it for them, we were going to have to do it for everyone in the department, or at least the employees that are in the field. So that's why we just decided not to. If that's something that you want us to look at, though, we will. I think all of them have already purchased them, but maybe we decide on allowance and reimburse them or something.
It's just a suggestion.
Yeah, let us look at it, and we'll look at it in terms of the other contracts, too, because I don't know how comparable the equipment that we provided them is. But I think you raise a decent point in that if we're not, going to stay close to that, we're likely to push them again to consider unionizing, which is what they've done in the past.
That's exactly my point. And as far as the other employees, if their job under Myosha rules, say for an example, I'll pick on Jill Case. If Jill said, Georgia, you bought them for the outside people, I want a set of steel-toed shoes. If MIOSHA says she needs a steel-toed shoe to accomplish her job, then perhaps we ought to give her an allowance too. But that's how you would deal with the other employees, in my opinion.
I guess I have a couple comments, if I could, please. I'm a little bit confused. I've had my share of experience with MIOSHA along the way, too. Did MIOSHA come in to do an inspection, or this letter was sent?
They received an anonymous complaint, and they sent the letter. They didn't do an inspection.
How did you know they received an anonymous complaint?
They told us.
Did they show up at your door and tell you?
No. They sent us this letter, certified mail. I got a letter, certified mail, October 15th.
That absolutely amazes me, because I have been through a couple anonymous complaints, and I don't know about it until the guy with the white hat walks through the door.
Well,
He sent
I
me
think
a certified
It
letter.
can be done both ways. They indicated, basically, we're leaving this to your discretion to deal with, and if
So,
you deal with
another-
it, you know,
That'll
that'll be fine.
Like I say, because I've had my share of anonymous complaints, and when they come through the door, the last time, 2 of them spent 3 weeks in my facility, so I have been through this a couple times before. But what I can tell you is that you can make steel-toed boots a requirement of employment, absolutely positively, and they have to have them, because that's what I do. I furnish gloves, I furnish uniforms, I furnish safety glasses, I furnish welding hoods, but I do not have to furnish them with steel-toed boots. And MIOSHA has stood behind that repeatedly. So, as far as the discussion of whether or not it's a negotiated thing, that could be because we provide footwear in some of our labor contracts and we don't with theirs, that's a completely different deal. But you absolutely can require that the steel-toed boots are provided by the employee as a condition of their employment. The other thing I guess I would add to that is one thing that you have absolutely is failure to wear personal protective equipment is absolutely grounds for which you can discharge an employee.
We know,
Document twice that you warned them, and they're gone, period. And they cannot collect unemployment, and they have no recourse against you.
We've already, Jill and I went to an OSHA training 2 days before I got the letter, which was another interesting coincidence, but they did teach us that, and so we're going to, Jill, now that Jill's out in the field more, she's going to be checking to make sure they're wearing their gear. We've always stressed that, but we've just given them reminders, and in the training, they told us that ultimately, I will be held liable if they don't wear their gear, so they're going to wear their gear. And if I am out and I don't see them wearing their gear, we already let them know, too, in a letter that we're going to just discipline immediately if they aren't wearing their gear. And most of the protective gear that we've gotten has been either at their request or because we were worried about them getting hurt in some way, which is why I'm glad I got the letter, because some of the things they did without my knowledge, and some of the things, the gas cans, for instance, we purchased from a local vendor who we thought they knew what they were doing. We thought they were already OSHA approved, and they weren't. So we had to go back and rebuy all new gas cans at almost $4,000. So that was a little disturbing to me. So now we've learned that we need to investigate online with OSHA instead of trusting the local vendor, which is very disturbing to me. But anyways, the boots, we talked about that because we felt bad the guys were going to have to go out and spend, probably $100 on boots. But I don't know, I just thought at some point I have to draw the line at how much we can provide. It drives up our unit costs, and but we can we can talk about an allowance.
Just a suggestion.
Ross?
So, you didn't have a policy before requiring steel-toed boots for the home shore people?
No, we investigated it. In fact, I think we talked to MIOSHA several years ago, and they, I'm not positive it was MIOSHA, but I'm pretty sure it was, and they told us they did not have to wear steel-toed boots. So we dropped it at that point. And then we get this complaint, and they said they should be wearing steel-toe boots. So I think it's just...
I mean, I've had jobs in the past where, it was a requirement, and I went out and purchased them, and nobody gave me any money for it. It just, if you want the job, that's what you have to do, so.
We were just, I think our main decision was some wanted insulated, and some didn't want insulated, and some wanted this brand and that brand. We're trying to figure out how can we do this fairly, and so we just decided to ask them to buy their own, but maybe an allowance is a good way to do it, and they can get what they want, but they're going to have to pay the difference,
It would
so.
be interesting to know whether or not OSHA would have actually determined that those people needed steel-toed boots.
My guys told me that,
I mean, I know what you're saying, and I know what your anonymous complaint made, but I still question whether or not they would be required by my OSHA standards to wear the steel-toed boots.
the guys told me if a mower ran over their foot, the boot wouldn't matter. Their foot would be gone anyways, or the same with the snow blower, so I think it's more for dropping something on their foot maybe than the mower or blower issue.
And you have to be able to document what they're lifting that's heavy enough to crush the foot anyway, and there's a whole mirage of things that goes into the decision of whether or not steel-toed boots are required, but that's, not our discussion. The decision has been made to require steel-toed boots as a condition of employment, and there's nothing wrong with that decision, and I think from there you move forward. Chris, you had something else you wanted to add?
Yeah, I just wanted to add, we were required in the oil field to wear steel-toed boots, and we were given a set allowance. I think it was like $50, but 10 years ago, boots were a little cheaper than they are today. But that way, people could do exactly as you say. If somebody wanted to order special purple steel-toed boots, that would have been me, by the way, they could. So an allowance, I think, is the way to go if you decide to move forward.
How would we figure out what that amount would be? We'll talk.
We'll talk
Okay.
with HR and we'll
Okay.
figure that out.
Right.
Mr. Chair, I had a follow-up question.
Yes.
Before the topic was changed back to the Commission on Aging, I had a follow-up question on the pool. Dennis, you mentioned the policies. Was there a policy in place that was violated, or was there no policy in place that now you'll be generating?
There are policies for dealing with emergencies that were not violated. There are not policies specifically dealing with chemical spills at the pool, which will be developed. There are policies for wearing, for appropriate apparel for utilizing this type of chemical, which, by the way, we're changing the chemical, and that was not followed.
Okay. Further question? All right, any other commissioner comments or committee
I
reports?
just wanted to add one more thing. Dennis, I think another thing that we need to look at is how we inform the public, because two people who happen to be voters in my district were exposed. One while the chemical was being poured into the drain, and another one, I'm not exactly, well, anyway, two people. And they learned what the chemical was from me. And they specifically requested from the office to be telephoned, to be informed as to what exactly they were exposed to. And the information they received, they got from me.
Well, we've gotten, through this whole process, we've heard a lot of interpretations of what happened. We're trying to get to the bottom of the exact thing, which is made more difficult with a lot of back and forth discussion in terms of he said, she said, that kind of thing. And I had actually two public who I talked to about this issue, and they had heard different stories from two different people, and so there's a lot of confusion out there. And so I think you're right. I think a policy would be good on how these things would be handled. But I think once this kind of thing takes place, the most appropriate way to handle it is to have a spokesperson who will deal with the issue as opposed to multiple people who are dealing with it and involving themselves in the investigation.
Okay. Are there any notices or announcements? Dennis, you'd requested a closed session. Can you tell me what that's for, please?
We need a closed session to discuss labor negotiations with the dispatch supervisors unit.
Mr. Chairman, I would move that we go into a closed session for labor negotiations with the dispatch unit.
Dispatch supervisors.
Dispatch supervisors unit.
Motion by Hooper, supported by Thomas. Is there any further discussion? I believe we need a roll call vote for closed session, please.
Commissioner Inman?
Yes.
Sure.
Maxbauer?
Yes.
Richardson?
Yes.
Thomas?
Yep.
Please?
Yes.
Friend?
Yes.
Cooper?
Yes.
Chairman Wheelock?
Yes, ma'am.
And I will point out, Jamel Anderson will be joining us. She's the department head.
Do we anticipate making a decision coming out of this?
No.
Okay, so we will be going into closed session. We will return after the closed session. It is not anticipated that there will be any decision made at this meeting.
Correct.
Hopefully it won't.
So nip and tuck. I heard Mike's wasn't even determined for sure.
Well, Antrim, I heard, they were waiting.
Mike won.
That's why, yeah, but then I heard on the radio that it wasn't fully determined.
They don't.
We need to take a picture of him before November, the end of November, he goes to judge's school in Colorado. So I think you should tell him, I want a picture of you before and I want a picture of you after. I want to see if you've changed.
Distinguished.
I want to see the black robe.
Will he still be able to drive that Mustang?
Motion to come out of
Well, you know, it's
closed session.
it's nice that he's been on
Just a
both sides of
second
the
here.
budget.
Yeah.
I'll entertain a motion to come out of closed session.
So moved.
Motion by Thomas, supported by Friend. Any further discussion? Those in favor say aye.
Aye.
Okay, we are now open. Is there any more business to come before this county board this morning?
Motion to adjourn.
Support.
We're gone. Thank you very much, everyone.